We do receive a lot of calls per day, ranging from 200 till 300 calls per day sometimes, especially in 2011. Kids under 3 or 4, they're always, prone to any incident at home.
Most of injuries and death in children caused by these unintentional injuries at home. We see day after day lots of accidents, lots of preventable. 80% of these injuries are preventable.
Poisoning, including food poisonings at home, near drownings if there is swimming through around the swimming pool, and maybe taking bleach or soaps at home, which has not been properly secured in a place, and family should be very careful to secure these items at home. Here people are depending on the housemates mainly, and then the housemates don't have any proper instruction at home. I never come across that someone applied at home anything. It is very, 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 I can tell you, very rare, means that maybe 1 out of 100. And no one can resuscitate or take care of their own baby due to non-awareness of these situations. But if there is proper awareness and certified these people through proper trainings, which is recognized trainings, and they give them the chance to do, they will save a life.
So we try to teach basic skills that can be used by caregivers to save lives, because by the time help arrives, it will be sometime too late. So these basic skills can make a difference between life and death. Back to Basics covers all the needed first aid essentials, from how to deal with the choking kids, how to deal with allergy. All of these very essential, and you can encounter almost every month.
This is the first certified and recognized trainings by our centers, and I encourage people to go through these programs. This will give awareness and encourage them to do any interventions if unforeseen condition happen for anybody at home.
The program is an excellent program. It is adopted by a reputable international organization. It is very thorough, very detailed, and it is thorough enough to give the caregiver the essentials to be able to perform the task that they are required to perform and help these kids.
To train the housemates around them, even the family who care for their child, to train the babysitters and someone who's caring for those babies. The main important thing is that during any first aid is that to preserve life.
We have many nannies that they have saved lives. One of the nannies, she was in a restaurant. She saw a 10-year-old child choking in a marble small stone.
So she put in her mouth, and then I saw her like she was choking. So I applied back slap, 5 back slap, and then thanks God the stone came out and the girl was fine, doing good. We have to be prepared because accident can always happen. I feel prepared especially when I took this course, because it feels like I have confidence to help people. It's very worth it for me.
Recently, we had a local mommy whose baby at high risk for stop breathing at home because being born premature. So we trained mom and dad for simple CPR. Baby goes home and got viral infection, stopped breathing, turned blue, and the mother immediately started performing CPR, and she revived the baby. It saves lives. It's as simple as that. It makes a difference between life and death.
Preserve life and promote recovery is the important message which everybody should know about this one.
Back to basics. It is very effective, and it will help these kids.